Hello everyone, this is Nayiri from Low Carb and Fasting. Okay, our guest is from Scotland. She has a degree in medicine from the University of Edinburgh. She also has masters in medical laws and ethics. She's an NHS consultant psychiatrist working in Scotland. She's also certified in functional and metabolic health. She's a member of the British Society of Ecological Medicine and the Royal College of Psychiatrists. She's also the author of Metabolic Madness. Dr. Rachel Brown, welcome to Low Carb and Fasting.
Oh, hi there. Thank you for having me. Gosh, what an introduction.
It's all on your website.
Oh,
okay. So Dr. Brown, let's start off with your book, Metabolic Madness. What are we talking about here? Because there's no mention of psychiatry, and you've been working in psychiatry since 2004.
Yes.
So Metabolic Madness, what are we talking about here?
Yes, so it's really about the emerging field of metabolic psychiatry. So I trained with Dr. Georgia Eade, who's a very well-known psychiatrist, who's really one of the big pioneers in this area. And I trained with her in 2021. And I just really wanted to put everything down on paper, to put all the links together in terms of explaining to both myself and other people, anyone who really was interested in all of the different links between metabolic medicine and mental health. So I wrote the book really because I don't often get enough time in my day job to tell people that I see within the NHS everything that I would like to tell them, because it's such a vast and complicated subject. So I wrote the book really just to cover the evidence base and put all the connections together as to what the underlying causes of mental disorders appear to be and what we know now, because things have moved on a lot from the theories just about neurotransmitters.
So when I had Dr. Brett Sher, who's a cardiologist, on this podcast, I remember him coming up with this genius statement, and I often quote him. He said, heart health is metabolic health. Do you think we can say something similar about mental health? Is mental health that closely related to metabolic health?
Well, absolutely. It certainly seems that way. And I've had the pleasure of being in touch with so many different people now that have really improved their mental health through making changes to their diet and lifestyle in order to optimize their metabolic health. So yeah, in the book I cover a lot of the evidence in terms of the studies that we have showing that there are much higher rates of type 2 diabetes and insulin resistance in populations with diagnoses of mental disorder. And also there's emerging research showing that treatment outcomes are improved when you optimize metabolic abnormalities that are underlying. So there are very close links between the two.
So when we say mental health issues, which ones are we talking about? Or which ones can improve with lifestyle change?
I would say all of them, because although I'm required to diagnose and categorize people's difficulties according to classification systems, the longer I work and the more people I see and the more I understand the science behind underlying causes of mental disorder, the more I think that we don't necessarily have very discrete disorders. So I think there are underlying causes that are in common with all different diagnoses. So we're talking anxiety, depression, bipolar disorder, schizophrenia, Alzheimer's, anxiety disorders, you name it, it's across the board really. And we have some more evidence in some areas than others. So Alzheimer's, for example, is one of the areas where we have very rich evidence pointing towards insulin resistance and type 2 diabetes as being causal in relation to developing symptoms of dementia, and there being brain energy deficits in dementia. Some researchers even coined the term type 3 diabetes to mean Alzheimer's disease because the links are so close.
Mm-hmm. I've always objected to that, though. I don't want to know of another diabetes. I'm type 1 diabetic, you see. So people
Okay,
already
yeah.
mix up the type 1 diabetes and the type
Oh,
2
I know.
diabetes, and it drives me crazy. Oh, did you eat too many cakes when you were growing up? No, no, I
Oh.
didn't. No.
No. Oh,
And
I
it's
know type 1 and
a
type 2
number of, yes, it gets so
completely different.
confusing. And then when you
Mhm.
throw in, there is also 1.5. And then when you throw in
Oh, I
type
know.
3 diabetes, it's going to get too confusing.
Yes.
Okay, so let's talk about autism is one thing you didn't mention. You do have a blog. It's a brief one, but I'm sure you cover it in the book. How is autism or the autism sort of the spectrum even linked to metabolic health?
Oh gosh, so one of my big interests is the gut-brain connection. So we have a lot of research out there showing just the very close links that happen between our gut and our brain. And obviously it matters what we put into our gut because it's the interface with the external world. When whatever we eat comes in direct contact with our gut lining. And there are some very good studies showing, particularly in populations with autism, that they have a higher prevalence of leaky gut or increased intestinal permeability. And the reason that this is relevant to mental health is that we know from the research that when you have leaky gut, it means that toxins, bacterial toxins, food particles can cross over the gut wall and enter the bloodstream, and then they can travel to sites distant within the body. And they trigger off an immune system reaction when that happens. So you have release of inflammatory cytokines, which are a certain type of immune molecule. And we know that when that happens, there's evidence to suggest that our blood-brain barrier, which is a very similar barrier to the gut, but it's the interface between the brain and the systemic bloodstream, it can also become leaky. And when it becomes leaky, because of this cytokine storm and the immune reaction that happens in the body, then it means your defenses around your brain are partially broken down, and toxins and other molecules can enter into the brain directly and then cause inflammation in the brain. We know from clinical studies actually in postmortem brains in autism that that population has higher markers that are to do with the tight junctions in the gut. So those are proteins that help regulate the sort of gaps that are between the gut cells that open up when you have leaky gut. So there is some quite clear evidence to suggest that gut health is very relevant in autism, and studies showing that gluten, for example, can exacerbate symptoms. There are studies in children in autism showing that excluding gluten and dairy can really bring about symptomatic improvement in that cohort. And then I've had other people contact me gaining benefits in terms of following a ketogenic diet or even a carnivore diet. So yeah, very interesting stuff.
See, to me, I don't know much about this area. I know more about type 1 diabetes than the sort of the whole sort of area of mental health. But the autism part is it's very interesting because we diagnose children with autism. So it's very different from dementia, which is the disease of the elderly. Although more and more, we're seeing more and more sort of younger people now being diagnosed with early sort of signs of dementia or Alzheimer's, one or the other. But so is it happening? Is it that the children are born with it? What do you think? What's your take on the sort of autism part? Are children actually born because of certain metabolic imbalances in their mother?
Quite possibly. So I was just going to mention there are studies showing that cohorts with a diagnosis of autism are lower in certain nutrients when you measure it on blood tests. So for example, carnosine and carnitine levels tend to be lower in that population. I don't know if there's any specific research into pregnancy and nutritional state of the mother, but certainly it wouldn't be a wild leap to suggest that the nutritional state of the mother, certainly during pregnancy, but also beforehand, may have some relevance. And obviously there are lots of other things that can happen during pregnancy that may affect the developing baby. But there are other aspects as well. So I'm just thinking there are studies that show that people with autism have different ratios of omega-3 to omega-6 fatty acids. So they have a more exaggerated omega-6 level versus omega-3. And we know these days that the ratio should really be close to 1-to-1. And I think the average figure these days is more like it's about 30-to-1 of omega-6 to omega-3. And that is because of the inflammatory fats that we consume within our diet. So specifically the seed oils, rich in linoleic acid. So seed or vegetable oils, people might know them as.
So when you're seeing your patients, do you use medication? You obviously have to use medication in some cases, but how do they take the recommendation of dietary sort of change?
Yeah, so it's interesting. Different people respond in different ways, that's for sure. I'm currently working within a crisis team, so I often see people in very difficult circumstances. And some of the people I deal with are acutely suicidal or floridly psychotic and very detached from reality. So I have to pick my moments, and there are certain situations where it's just not appropriate to broach the subject with those people. But for the other people I see who are in a better place to listen to that sort of advice, I get mixed reactions. So some people just aren't interested at all in changing their lifestyle or their diet, and they want a quick fix in the form of a pill or ongoing appointments with a therapist, for example, and they just have no interest or motivation to change. But there are other people who are extremely interested, and certainly a cohort of people who would much rather not be on medication if they could avoid it. And unfortunately, we know in psychiatry that a lot of our medications come with significant metabolic side effects, particularly if people are to remain on them longer term. So I've had a few people recently who've started ketogenic diets to improve their mental health, and I'm following them up after they've been discharged from the crisis service. So it's been really, really interesting to see their progress, and people in slightly different situations as well. So one lady who'd had really persistent, severe depressive symptoms and agitation in the context of bipolar disorder, and she had a very quick response and improvement after adopting a ketogenic diet. And various life stressors have come along that can destabilize people, but yeah, it's been really interesting to see the progress when people are willing to make lifestyle changes.
So when we say ketogenic diet, what sort of macros are we talking about, or do you not specify? You just cut out the sugar and the gluten from the diet and leave it up to them to eat anything?
Yeah, so that's so that person's really good at tracking, but I would say she's on a 2-to-1 or a modified Atkins style ketogenic diet. So a fair amount of protein in there. That particular person doesn't have a ketone meter, so we've been working in the dark in terms of what her levels are like in terms of ketones. But yeah, it really just depends on the person. And I think people vary in terms of who wants to track macros and all of that, and who just would rather stick to a broad figure of how many carbohydrates they're limited to in a day, and then fill in the rest of their food with proteins and fats. So
what are the things you limit, or you recommend that they limit, or completely cut out? Obviously, sugar will be one, right? Sugar,
yes,
processed foods.
Yes, processed foods. Excuse me, especially vegetable oils. Just most processed foods these days are full of seed oils, vegetable oils. Obviously, it's difficult. You can't really have potatoes or starchy vegetables on keto. So you would be centering your diet ideally around whole foods. We do know that there are lots of keto products out there now, and different keto dessert recipes and so on. But for the majority of people, I'd recommend they just start out with whole foods and center around meat, fish, eggs, healthy fats, such as butter, ghee, animal fats, some olive oil, coconut oil, some people like to include, and then low carb berries. So the fruits tend to be fairly limited, but it's the berries that tend to be possible to include to some extent in a ketogenic diet, and then some of the low carb vegetables.
Mm-hmm. Yeah, it's the diet I've been following for 8 years now. So for my diabetes. Okay, so you also talk about fat and how it benefits the brain. So why does our brain need fat? Not many people know. Not many people know about it because we've vilified fat for so long. People don't even realize fat is brain fuel.
Mm-hmm. Yeah, so a lot of our brain is made up of fat and cholesterol, and DHA as one of the sort of essential fatty acids. So cholesterol is just absolutely crucial for brain function and also for the lining that surrounds your nerves in your body. And yeah, I think we've been given a lot of bad advice in terms of avoiding fats and focusing more on grains and carbohydrate heavy foods, because ultimately complex carbs all are broken down into simple sugars in the body. So I don't really see what the difference is eating a complex carb, which is supposedly healthy, versus sugar. And then you get into difficulties with high fructose content and fructose being metabolized slightly differently in the body and being more likely to contribute to issues such as fatty liver.
Mm-hmm.
So fat, yeah, absolutely essential. And actually, when you're following a ketogenic diet, you have a metabolic shift, as you know. So you move from being a sugar burner to being a fat burner, and your brain can run on fat breakdown products, which are ketone bodies. And we know that ketones are a very clean source of fuel for the brain in comparison to glucose. We know that there are advantages to being in nutritional ketosis in terms of reducing inflammation levels in the brain. And we know from research that if you have a very high carbohydrate heavy diet, you will have inflammation in the body, and that includes and can include inflammation in the brain, because insulin serves a very important purpose, which is to drive down your blood glucose level, because too high a glucose level is damaging to the body. And we know that ketones can help to normalize some of the abnormal shifts that happen in neurotransmitter pathways when there is inflammation in the brain. Excuse me. So the tryptophan pathway is one of the main ones that we know about, where if there are conditions of inflammation, then you can have lowering of serotonin levels, lowering of GABA levels, and GABA is one of the main relaxation type neurotransmitters, one of the inhibitory ones. And then you run into problems with lots of high glutamate levels, with glutamate being one of the most excitatory neurotransmitters. So the one responsible for you feeling agitated or anxious. And we know a ketogenic diet can help to normalize those ratios again via its anti-inflammatory effects.
Mm-hmm. So can medications do the same? Oh, well.
I don't know is the answer to that. So I think some medications have some anti-inflammatory components to them. And that's possibly why, so coming back to heart health and cholesterol and statins, some of the advantage that they might confer early on after somebody's had a heart attack, there's a thinking now that that's to do with anti-inflammatory effects as opposed to anything to do with cholesterol lowering. And I think the same might come for antidepressants and other drugs that we use in psychiatry that way. But I don't really think that medications are addressing the underlying cause of illness.
Mm-hmm. Yeah, you do. You talk about the root cause, addressing the root cause. And that's what you do as a metabolic psychiatry practitioner. That's quite
yes. I'm confused because I've done functional medicine as well, so it gets all a bit mixed up with me.
So okay, let's talk about red meat.
Okay.
No one would believe that red meat could solve so many metabolic issues. Mm-hmm. No one, even a decade ago, it was all new.
Yeah.
I was vegetarian. It was only 2 years ago. I shifted to eating meat-heavy
Okay.
meals, and it changed my life. So
Yeah.
why do we need red meat in our diet? How does it help the brain?
So red meat is hands down one of the most nutrient dense foods on the planet. We won't necessarily get into arguments over organ meats versus muscle meats, but just red meat in general is highly nutrient dense and has protein and appropriate fats for the body that are very bioavailable, which doesn't always happen in plant foods. And there are many substances within red meat in particular, such as carnosine and carnitine and anserine and ubiquinone. There are lots of different molecules that have actually been shown to have anti-inflammatory and antioxidant effects at the level of the neurons in your brain. So I think that is why a lot of people find when they shift to a very red meat heavy diet that symptoms they may have had in relation to their mental health really do improve. And just thinking of that, someone popped into my mind who contacted me on social media who has autism, and they'd messaged me privately to say that going carnivore and going entirely animal based had really improved many of their symptoms of autism that they've lived with for years. So we just keep saying testimonial after testimonial when people do shift to a very meat heavy diet, and I think there are many different reasons for that. Of course, all the micronutrients such as the vitamins and minerals in meat as well are very important in different neurotransmitter pathways in the brain, because a lot of them act as cofactors in enzymatic reactions. And yeah, there are just many, many reasons.
Now, coming back to the fat. So when we say fat, the brain thrives on fat, but are we specifically talking about animal fats?
I would say so, yes, because I think if we think about what sort of fat we have in the body, then our fat is going to be fairly similar to that of other animals. And there have been some really interesting talks that I've watched from Dr. Paul Mason in Australia, particularly looking at heart disease and arterial plaques. And one fascinating podcast or video that he came out with was talking about how plant sterols may actually be part of the arterial plaque, and it may not have been cholesterol all this time. So he really put the question out there about whether he could recommend coconut oil, for example, or extra virgin olive oil to people anymore. And I think there's a big question mark over that. And I just find the whole subject fascinating.
Yeah, and we're finding out more. We're finding out more. I just recently interviewed Dr. Stephen Hussey.
Oh, yes.
Medicine doctor, and he
Love
himself
his
had a
work.
heart attack. He's type 1 diabetic as well. But at the age of 34 or 37, he was very young when he had his heart attack. So,
Yes.
yeah, his book does talk about all of those things. So, okay. So carnivore diet.
Yes.
Is it healthy? Because you're a carnivore. You're a carnivore now, right? You've shifted from
Yes.
keto diet to carnivore diet. So
Yes.
how
So 4 years
strict are
now.
you?
4 years I've
4 years.
been
How
carnivore.
strict are you?
Um, so the only things that I sometimes include which aren't carnivore would be occasional coffee. And I do sometimes add not spices, but maybe garlic. Sometimes I might have a bit of, but otherwise I'm fairly strict. So I don't eat, I don't feel the need to include any plants particularly in my diet.
And have you noticed any improvement in your health?
Yes, absolutely. So one of the biggest things for me was just about control of appetite. So I consider myself to be a sugar addict and hadn't really fully appreciated the extent of that addiction until I went carnivore. So even when I was keto, there was still a few foods that I was a bit more compulsive around. So nut butters, for example, and dark chocolate. And carnivore just gave me a food freedom that I'd never ever known before at any point prior in my life. So just the ability to be properly satiated and go for many hours between meals without even thinking about food, having no food preoccupation. But I've had other benefits as well. So immune health has been vastly improved for myself in terms of coming down with illnesses. And gosh, there were probably a few other symptoms that I'd lived with. I'd had a bit of heartburn before, and that's gone away. So yeah, things that you hear quite commonly. And I didn't go into carnivore thinking that I had any major health issues, that I needed to do it. I did it out of curiosity, and actually because of all the benefits that I've had, I just wouldn't think about going back again.
Do any of your patients consider the carnivore diet?
I had one lady recently who has had a recent diagnosis of colitis, so I felt that I had to mention to her, because there have been so many testimonials of people with ulcerative colitis and Crohn's disease who were on the verge of having immunotherapy and very advanced treatments because nothing else had helped, and then they've gone on to become symptom-free and have resolution of their gut symptoms. So I had mentioned to her, and she's gone fairly meat heavy, but she's not carnivore yet.
Yet. Okay. We were mentioning some of the diseases. We kind of mentioned the autism, but let's talk about the bipolar.
Mm-hmm.
What is bipolar? Because we're hearing more about it these days. I'm pleased we are, and I'm following the Ian
Campbell.
Ian
Yes.
Campbell's podcast as well on bipolar, and
Yes.
it's fascinating to learn more about it. So can we talk about bipolar disease and
Yeah, of course.
and how the carnivore diet or how at least the meat heavy diet may help the symptoms?
Yeah, so bipolar disease, some people might know it as manic depression, is what it would have been called previously. And it simply means that somebody has experienced episodes of either just mania or hypomania, which is a lesser version of mania, not quite so severe. Or people typically have episodes of depression as well. So it tends to be intermittent episodes of either depression or mania. And people can become psychotic in the context of severe depression or severe mania, but mostly you're looking at mood symptoms. It can be extremely debilitating. Some people develop rapid cycling illness, which is when they have multiple episodes in a year. And the evidence shows that people with rapid cycling bipolar, so lots of episodes in 1 year, are much more likely to have insulin resistance than not. And there's I think it may be a Canadian researcher who's published some research, and she works in, the name just escapes me, but she works in a clinic for treatment resistant people. So she does see a lot of people with major mood disorders like bipolar. And it was very interesting listening to her speak about her study. So she had patients who'd responded to lithium, which would be the gold standard medication within mainstream psychiatry for bipolar disorder, to lithium as a mood stabilizer. And she was seeing cohorts of people who used to respond to lithium, but as they got older, no longer did. And when she was able to reverse their insulin resistance, I think that study was using metformin, but diet would be another way of doing that. She was able to bring those patients' symptoms under control again with their treatment. So yeah, I'd actually been involved in a study recently with Ian Campbell, because we're both based in Edinburgh, and it was a pilot study of a ketogenic diet in bipolar disorder, and there were some really interesting results from that. So some people who did very well and have chosen to continue on with the diet. So it's certainly a treatment modality. It's just the research isn't quite up to date. Unfortunately, because there's no drug company that's going to fund a trial into something that they can't patent. Let's be honest at the end of the day.
Yeah. Have you published the study?
So it's been submitted to a journal, so we're just waiting to hear back.
Yeah, I'll look forward to it, and at some point when it's published, I'll add the link to the video description as well. Okay, one of the most common mental health disorders, I would say, that I come across is depression. Mm-hmm. I have depression. Oh, I'm on medication for depression. There's anxiety as well, but depression seems to be so commonplace now.
Yeah.
What exactly is it? How do you diagnose someone with clinical depression as opposed to someone is under tremendous stress for whatever reason, and they're just stressed and depressed and sad about their situation, and then that sadness eventually goes away? Now, clinical depression, though, is not like that. It's not going to go away on its own unless some intervention has been made. Am I correct?
Yes, yeah, you're correct. Although actually episodes of depression do and should eventually remit themselves, even if there was no intervention. The difficulty is that for some people, they develop suicidal ideation in the context of being depressed, and there can be risks if they're left untreated in terms of profound hopelessness and suicidal thoughts or intent. But a diagnosis of depression really just comes from a symptom list. So you have to have had symptoms for a certain duration. It's sort of 2+ weeks, and then you would look for biological symptoms, so sleep disturbance and reduced appetite and poor energy levels, poor motivation, poor concentration. Some people present with a very agitated form of depression, where they're just highly agitated and unable to function, and that tends to be at the more severe end of depression. And again, you can develop psychotic symptoms in depression too when it's very severe. So people can sometimes believe that they're already dead and no longer alive, or experience auditory hallucinations, for example.
And is it common to see weight gain in people? So, I mean, if insulin resistance is the underlying cause of many of these mental health issues, then I would assume weight gain would follow insulin resistance, although it doesn't always. But do you notice that? Because a few people that I know who've been diagnosed or on medication for depression, they're just starting to gain weight. And I just want to look, try the ketogenic diet. Look,
that might be partly medication. So some of the antidepressants can cause weight gain. Not all, but I think even some of the ones that we think don't cause weight gain, there's evidence that they can actually lead to people gaining a fair amount of weight. I think what I would see is usually when somebody's very depressed, they would lose weight during an episode of illness, unless they have an atypical presentation. So you do have some people who eat more when they're depressed, although we would consider that to be atypical. But I would say that the general health of the population isn't great to begin with. And so your average person is likely dealing with central obesity or being overweight and running the risk of high insulin levels, and eventually be on their path to insulin resistance. So yeah, I mean, I think of depression as an inflammatory condition. So there's certainly a cohort of people who have raised inflammatory markers, and we know already why inflammation would trigger off changes in neurotransmitter pathways in the brain, and inflammation in itself involves an immune system response, and even these immune molecules can trigger off inflammation in the brain, and so there's just many different mechanisms that can underlie depression.
Food addiction.
Oh, okay.
That's also governed by the brain, right? And
yes.
so it's a brain issue, and you cover that on your website as well. And so how so did you have food addiction?
Definitely a sugar addiction. Not so much. I know some people struggle with sort of bread and those kind of complex carbs or starchy carbs, and that was never really much of an issue for me. It was the pure sugar that was more of an issue. I think, gosh, I don't know that we have accurate rates of food addiction in society, because it hasn't been properly recognized, although there's a lot more work going on in this area. So and I'm absolutely supportive of the work that's happening, particularly with people like Dr. Jen Unwin and Bitten Johnson. There are quite a number of different people out there really advancing the knowledge and the therapeutic options that there are out there for people who do suffer with food addiction. But I would say, from what I see, even people who aren't necessarily overweight, I observe a lot of behavior that suggests food addiction. I remember Georgia saying when I was training with her that she'd never really come across someone who described themselves as a foodie who didn't have a food addiction. And that seems to be normalized on social media. So, you know, I know people who just post constantly about their food, and the majority of it's fairly unhealthy, in my opinion. And the people I'm thinking of are struggling with metabolic issues, definitely. But I'm a big fan of abstinence when it comes to food addiction. So my own personal experience has been that carnivore has really actually changed the taste that I have. So so occasionally, for example, when we've been out for a meal, I can't remember the last time I did it, it's probably a year or two ago. There was some ice cream left over from someone at the table, and I thought, I'm just out of interest, I'm going to take a spoonful of that just to see. And I really despised the taste of it, the sweetness, which is shocking to me as somebody who is a former sort of sugar junkie, really. But I think if people can aim for abstinence and give their bodies a period of recovery time where they stop triggering off the compulsions and the sort of brain response that would be fueling further cravings, then it is really possible to heal from food addictions.
Mm-hmm. It's a process though, right?
Yeah. Oh yeah, I think it can be more complicated for some than others. So certainly there can be just psychological factors at play as well, and associations that people have with food and how they use food, and it can get quite complicated that way.
Mm-hmm. Yes, it can get complicated because of pressures in our society and people pushing.
Oh yeah, family are some of the worst, aren't they?
Just one bite, just one piece.
Yeah.
They won't harm you.
Yeah.
Right. Now, mitochondrial health. I talked at length with Dr. Stephen Hussey when we're talking heart health, how important mitochondrial health was when it comes to the heart. But now the same seems to also apply to the brain.
Yeah.
Why is it important to look after our mitochondria? Let's start with what are the mitochondria and why do we need them?
So they're the little organelles, so tiny, tiny things in most, if not all of our cells, most of them anyway. And they have many different functions, but one of the most well-known functions is for production of energy in the body. So I immediately think of some of the work by Dr. Sarah Myhill in the UK, who's been a pioneer in terms of advancing treatment of chronic fatigue syndrome. And again, chronic fatigue absolutely comes down to mitochondrial health. But you also see the same symptoms in depression when people shut down and don't want to do anything and they don't have the energy to do anything. So that would be a sign to me that mitochondria are very crucial in that situation. But they're also responsible for managing free radicals in the body. So in the process of forming energy, they do produce a certain level of oxidants in the body, and we know that ketogenic diets have favorable effects in terms of reducing oxidative stress. And oxidative stress is a term that's thrown around an awful lot, but it just really means when there's an imbalance between the antioxidants that we have in our body to begin with and the pro-oxidants or free radicals, which are the unstable oxygen molecules that cause changes to DNA and cause dysfunction in the way different cells function in the body. And we know that oxidative stress plays a role in development of mental health symptoms. So that's a brief summary.
How do we look after our mitochondria?
Oh, so again, that comes down to having a species appropriate diet. So something that is ancestrally appropriate. And in my mind, that means a very low carbohydrate ketogenic diet, and with carnivore being a subset of a ketogenic diet. So I don't think everyone needs to be carnivore, but certainly the majority of people would do well if they were to cut out the sugar and the carbohydrates and keep that to a minimum. There are, of course, other things that can be done. So looking after your light routines and participating in grounding, so just having contact with nature for transfer of electrons. And I often think of Stephen Hussey because I know he talks a lot about
Yes.
the importance of that. But just we know that having contact with nature brings the body into a parasympathetic nervous system state. So that's the relaxation state. And often with many mental health disorders, there's too much sympathetic activation, so too much cortisol in the body, agitation, people being on high alert, unable to relax. And so I'm a huge fan of people getting out in nature and having actual physical contact with the earth, because we know that can affect measurable outcomes such as heart rate variability, which is one measure that some people like to track.
Now with psychiatry, now that we are talking about tracking, so what lab tests do you actually do on people?
Not as many as I would like us to do. So the standard would be checking for things like anemia, checking kidney function, liver function, thyroid function is really important in mental health. And then for some situations, checking B12 and folate levels. And sometimes you'll do cholesterol and lipid checks if you're thinking about starting people on medication, but that's pretty much covers the standard set of tests or blood tests that would be done within psychiatry. If someone presents with a very unusual presentation, there might be other things that are tested for, if you're looking for syphilis, for example, or other autoimmune type markers. But the standard would be the liver, kidney, blood glucose as well. We should be doing that. We're not always the best at doing. But I personally really wish that we would be checking fasting insulin for people, because that would pick up people who are likely to run into difficulties or already be in difficulty because of insulin resistance at a much earlier stage. So I suppose that follows a lot of the work by Ben Bickman, who talks a lot about the glucose-centric approach that we have to diagnosing type 2 diabetes is just failing miserably because people are pre-diabetic for at least a decade before. And it would be possible if you're measuring a fasting insulin to pick people up at a much earlier stage. Mm-hmm. And I think would also improve outcomes in terms of treatment for psychiatric disorders, particularly mood disorders, where we know that insulin resistance plays a big part.
I've always wondered what do the are there different so most of the psychiatric medications, what do they do? What are they? Are they like additional do they contain nutrients? Are they hormones?
No, they target neurotransmitters primarily. So they target chemicals such as serotonin or noradrenaline. Some of them target dopamine in the body, and you get slightly different effects. So that there are lots of groups of antidepressants, and they all have slightly different actions, but work on similar neurotransmitters. But you're really just playing around with levels of neurotransmitters in the brain when it comes to psychiatric medications. The exception being drugs like diazepam, for example. They are very effective in the short term, but highly addictive. And they work on GABA, which is the main inhibitory neurotransmitter I mentioned earlier that's responsible for relaxation.
It's fascinating. So in theory, they should make a difference, except the side effects, of course, right?
Yeah, so treatment outcomes vary from person to person. So some people do really well on medications, and then we see other people who end up trying lots and lots of different medications and don't necessarily get the optimum result that they would want. But I've certainly seen medications being helpful in people's lives. I just think there's so much more that we could be doing that we're not necessarily doing in mainstream medicine. So there can be lots of other underlying issues for people, such as problems in their gut with dysbiosis, so alterations in the proportions of gut bacteria. We don't test for any of that. We don't test for other toxicities, such as heavy metal toxicities or environmental issues. So mold can be a big issue for some people, or organophosphates, so substances that actually disrupt other neurotransmitters in the brain, such as acetylcholine. We know that organophosphates do that. So there's a whole wealth of other things out there that aren't really particularly paid attention to within mainstream psychiatry, but that would fall more into the realms of functional medicine.
Mm-hmm. Do you use any supplements in psychiatry? Do they have a place?
Standard practice, I would say on average, no. So in days gone by, you might have seen fish oils being supplemented for some people, particularly in psychosis or schizophrenia. But as standard, no. So people don't look at sort of the B vitamins or micro deficiencies that people might have, other than a B12 and a folate, which would be the standard blood test, but they're not testing for any others. I, on the other hand, I'm quite a fan of supplements, so I do mention them to people if they want to look into certain things.
Mm-hmm. Right. There's bi-directional communication, you said, between the brain and the gut. So they're constantly talking to each other. So.
Yes. So we have the hardwired connection in the form of the vagus nerve. So that's the hardwired connection. And we know that signals go both directions, from gut to brain and brain to gut, but they also signal to each other in other ways, so via the immune system and via hormonal systems. So there's chemical messaging that happens between the two as well. A really interesting example, I think, is the effect of stress. So we know that just even fairly low levels of stress, so obviously you're taking in information visually and other forms of communication in terms of hearing and interactions with people, and that's nothing to do with your gut, but we know that when people are under stress, that can cause leaky gut. So it's quite clear that's one clear example of brain to gut communication. I suppose another one might be when people are nervous going for job interviews, for example, or other situations where they get butterflies in their stomach, or even gut symptoms like diarrhea, for example, and in anxious states that can happen. So that's another example of brain to gut signaling. And then actually a lot of the neurotransmitters are manufactured by the bacteria in our gut. So serotonin is in proportion, about 90% or so of it is produced in the gut, which I was never really taught or aware of in my training. But yeah, the connections between the two are just increasingly becoming known, and just absolutely fascinating.
That's the first time I hear of that, but so we can confidently perhaps call the gut the second brain.
Yes, it has been called that. Yes,
it has been called.
It has been. Yes,
amazing. Right, coming back to your book. So I'm going to put the link below so people can buy the book. By the way, I will buy it. I haven't yet, but okay. So why madness, though? Metabolic madness. What are you talking about? What are you referring to?
Oh, so just
situation of metabolic sort of crisis.
Yeah, I'm really just referring to mental illness, so an old-fashioned way of referring to it as madness. So yeah, like I said, I'm not a huge fan of diagnostic categories, and I think many people experience symptoms that transcend different categories. So I really just wanted to get the connection between metabolic health and mental health type symptoms.
That's been a wonderful, fascinating conversation. Thank you so much for your time. So once I've read the book, I'll have another set of questions and I'll invite you and have a second discussion. Dr. Rachel Brown, thank you so much for your time today.
Okay, well, thank you for having me. It's always interesting to talk about this stuff.
Thank you. Bye for now.
Bye.